Hello and welcome to our podcast series featuring OrthoFX experts. I'm your host, Danny Pullman. In this series, I speak with doctors who have made the switch to OrthoFX, a new generation of aligners designed to improve predictability and support patient compliance in a whole new way. Our guest today is Dr. Pegah Bakhtiari, a cosmetic dentist with a busy practice in Los Angeles. We'll discuss her experience with the advancements OrthoFX offers and how it has impacted her practice and her patients, and why now may be the right time for you to consider a change for your own practice. So yeah, if you could just introduce yourself, let us know who you are, what you're about, tell us about your practice, where you're at, tell us all the things about you that we want to know.
My practice is in Culver Marina area, Marina Del Rey, Culver City, kind of on the border. We've been practicing there now for 10 years with me as the owner. And we're a general practice. We treat everybody from children to the parents to the grandparents. And we kind of like to really focus on not only cosmetics, but also comprehensive care. So we really want to treat the patient as a whole. And the goal of that is to do it with the highest technology and the latest research.
So do you have any success stories lately that you're excited about? Anything you're celebrating in your practice lately?
Actually, October will be our 10-year anniversary.
No way.
Fun fact, yeah, 10 years in my hands. The office, funny enough, has been a dental office in that building, in that suite for, I think, since the 70s. So it's gone through many different dentists' hands and different groups. But when I took it over, we really did a lot of change in the office. It's really nice to kind of have this office that's been in the area for so long, but looks so different and so new. So when old patients come in, they get this like revamped new feeling inside. So that's really exciting for me.
Congratulations on the 10 years.
Thank you.
It's
Thank
a big
you.
milestone.
Big milestone. Exactly.
Yeah, amazing. All right. Could you just talk to us about how aligner treatment fits into your clinical practice in general?
Yeah. So, kind of in line with the comprehensive care treatment, a lot of times, patients come in and they'll have either wear issues or hygiene issues or cavity issues. And it's not just about their oral hygiene and their, grinding and the way that they treat their teeth. It really has a lot to do with how their teeth are aligned. And so aligner therapy really helps us kind of look at every piece of the puzzle and make sure that the teeth are properly aligned so that the patient can really have long-term success with the health of their teeth.
Yeah, and can I ask you a follow-up on that? How do you incorporate those conversations with patients into your practice? Is it just you talking to them about it? Is it your team members as well? Can I get a feel for that?
Yeah, it's actually the whole team that talks to them about it. It starts with, a typical new patient coming into my practice will first see, first they'll talk to the front desk and then they'll come in and they'll experience the assistants taking x-rays and records, and then they'll experience the hygienist who will, do some gum evaluations and talk to them about their gum status and periodontal status. And then so the hygienist and the assistants are probably the first people that will talk to the patients about aligners and orthodontics in general. And then by the time they get to me, they've probably heard some things already from the assistants. We take an intraoral digital scan, so they'll get to see their teeth on a screen before they even see me. The hygienist will use that digital scan as a teaching tool and show them, where they have their buildup, where they have their crowding, where they have their recession and their, any kind of gum issues that they have. And so they can visually see the things we see now, like right off the bat. So it makes discussing their oral care and oral treatment really easy. So it starts with that digital scan. And then by the time they get to me, they've kind of seen and heard all the things already. And I just kind of
Yeah.
help clarify or reinforce some things.
So do you scan every patient with a digital scan when they come in?
Every patient.
And
Yes.
you
Every
go through
patient.
it with them, you show them on the screen.
Definitely. Yes.
Yeah.
Big
Yeah.
part of our initial exam and also a big part of our follow-up exams yearly so that they
Yeah.
can see any changes or any improvements or any areas they still need to work on.
Yeah. Why do you do that? Why do you scan with everybody? And what have you noticed when you started doing that?
Well, I think as dentists, we're all about collecting records, right? Our records is what help us come up with treatment or, also like just to have a baseline of how patients come in. We used to do it with photos, intraoral photos, but now the scans are so advanced that they're basically like a million photos in one. So we do it as a teaching tool. It really helps, drive home the point of what you're trying to explain to the patient. We do it as an eye opener. Patients don't see what we see. A lot of times they think everything is great until they can actually see what we see. And a lot of times you don't have to be a dentist to really like see, oh yeah, this is problematic or I'm having trouble here. It's a good teaching tool and it's a good diagnostic tool. Also helps cover our butts because we have a intraoral scan of how they came in. So it's really good for documentation.
Yeah, that's another
So
good angle I didn't think about. But have you noticed it affect case acceptance at all?
definitely improves case acceptance. I think people are more likely to address something that they can visually see. It's like,
Yeah.
as opposed to hearing it from us or having to take our word for it, they can see what we're talking about. And so it 100% helps.
Yeah. Yeah. And then did your team just start doing this one day, just spontaneously, or did you take the lead and have to
Uh,
train them on implementing doing it this way?
Yeah, I mean, change is never easy in a practice. I think, anytime we go through big change with equipment or policies and procedures, it takes some time, but I think everybody has to be on board.
Yeah.
And, it's a little bit of work in the beginning to implement change, but yeah, when everybody's on board and definitely the doctors lead the way with making sure that we're being consistent in our policies and our procedures and every patient gets the same treatment. And, I think it's super worth making the change and it really pays for itself. However much you spend on a digital scanner or the technology, it pays itself back like a million times over. And I think patients now expect it. Most
Yeah.
offices have them. And
Yeah.
when they have never seen it before, they really get wowed by it because it's dentistry like they've never experienced before.
So basically, your team did not just start doing it, and you used some strong, decisive leadership to help stay consistent, and that helps trickle down to the team, and they get in the habit of doing it.
Yeah,
Yeah, absolutely. And the reason I
definitely.
wanted to highlight some of those questions and hear your responses on it is I talk to a lot of doctors, a lot of offices these days, and I just see the contrast between the offices who scan everybody and go through it with the patients and have the team involved talking about everything holistically, all the things, including
Right.
malocclusion or straightening teeth with aligners and just
Right.
asking simple questions that kind of prepare their brain for the conversation when you come in the room. It just ups case acceptance in a big way. It helps to have more aligner starts if we're just talking specifically aligners when you have the team involved as well. And
That's
the
true.
contrast is stark. So thanks for sharing your success story of implementing that with a team. That'll inspire some people who
Yeah.
hear this.
Yeah, it's definitely true.
Yeah. Yeah. And then at this stage in your career, what specific clinical or operational frustrations with your previous aligner system led you to seriously consider alternatives?
I think with previous aligner systems, one of the main things that I noticed was that sometimes you would get caught in these endless refinement cycles. And I find that with OrthoFX, my end of the line is has been a little bit more consistent where I'm not having to go through numerous refinement cycles. There's a couple of things, honestly, that I like about OrthoFX aligners. One of them is patient comfort. I get a lot of feedback from patients with other aligners that they experience pain. And with OrthoFX, it's really surprising. I'll kind of probe to see if are they feeling any discomfort or how was their experience. And patients get used to the aligners really quickly. And the fact that they don't feel so much soreness is really helpful in patient compliance.
So that's something you've
And
noticed
then,
because you like to stay tuned in and ask them how it's feeling, how it's going, and you've noticed the difference
yes,
in the responses you get with AirFlex compared to past aligner systems.
yes, 100%. Yeah, it's actually kind of shocking because you expect them to have some kind of soreness. And, sometimes they even say, like, I'm not even sure if something is happening because I can't feel it, so much on my teeth.
Yeah,
But of course it's happening because they're tracking and the case is going well and the teeth are moving and they're just not able to tell by the pain that they're experiencing. So it's
yeah,
kind of nice compared to other systems. And the last point I wanted to make about, why I like them and why I've switched is that they have like really good support as a company for clinicians and even for patients. Like they track themselves, they have their own tracking system. If the patient is compliant or if it's on track, they alert you, they alert the patient. So they're very involved and the clinician gets a lot of support through them. So I think that's a really big plus as well.
yeah, yeah. So the aligners are more comfortable. You like that, and you like seeing your patients benefit from that. And one of the
Definitely.
reasons they're more comfortable is because industry standard aligners have been about 8 times too much force, and AirFlex is the only aligner of its kind and the only aligner made of the material it's made of. To move teeth orthodontically, most optimally, you want to be between 40 and 200 grams of force. And AirFlex stays in that the entire week that patients are wearing it. Have you noticed too that it doesn't get loose by the end of the week as much as other aligners did?
Yeah, it doesn't get as loose. And also, I mean, the most amazing part I think about AirFlex is there's no there's no relapse. I mean, if the patient just stopped wearing it, you'd have some relapse, but the fact that the patient can wear it less and not have relapse where they wear it the same amount of time with another aligner company and they'll have major relapse. So that's a really big deal. I mean, patients, not all of them are going to be as compliant as they say they are with wearing the aligners. So having an aligner system that really accounts for, has like a solution to this compliance issue with not having to wear them as much and getting the same result and less relapse is kind of amazing.
Yeah, for those of you who don't know, AirFlex aligners, the instructions are to wear them 12 hours a day minimum instead of the traditional 22 hours a day. And have you noticed how that's affected compliance with your patient base?
It's really affected patient acceptance. Most patients, when they hear, oh, I can wear it 12 to 15 hours a day and get the same results as with another aligner company that I have to wear it 22 hours a day, most of my patients will opt for that because everybody wants a little bit of flexibility in their life without the punishment of not, of it not working.
Yeah.
So yeah, it's definitely affected case acceptance. And as far as compliance goes, I would say patients are just by default more compliant because they can wear it less and get the same result. Without trying harder, they're getting similar, better results than having to wear it 22 hours a day.
I love it. Also, one thing that Dr. Bakhtiari mentioned, two things were FX on track. She talked about how you can do remote monitoring with your patients in AirFlex treatment. FX on track is what we call it, and it's something available to try with any of your AirFlex cases that you do through OrthoFX. And also in terms of just finishing and detailing, wrapping up that case, parking the teeth right where you want. We also have precision finish aligners that have been added in this last year that help those last 4 stages just be that much more predictable. So, all right, let me ask you now. So, with all the ongoing innovation in the aligner technology and shifting patient expectations, what would you say to people? Like, why do you think now is a good time for doctors to reevaluate the systems that they're using?
I think patients have a lot of access to information. They can search on AI and figure out exactly all their options and where they want to go for treatment. So I think that if you're not offering them what they're looking for, which a lot of times is going to be less pain, faster treatment, less cost, all the things that patients look for, accessibility, convenience, then they're going to make a switch, and they're going to find it where they find it. as a clinician, we kind of have to keep up with the times. And I really think OrthoFX is kind of like pioneering in this new way of doing aligners.
Yeah,
We
definitely.
kind of
It
have to
is.
get on the boat.
Yeah, get on the boat. I love it.
Exactly.
It's a
Yeah.
good way to say it. Okay, and then you've been working with the OrthoFX system since how long did you say?
I think it's been about 5, 6 years. I
Yeah,
started with some of their other aligners, like they had FX Clear, FX Bright. And then a few years ago, they brought on AirFlex, and I've kind of been favoring that one recently. So
that's
yeah,
the
I think
12-hour
I've
one.
gone through.
AirFlex is the
Yeah,
12-hour one.
exactly.
Yeah.
Yes, exactly. So
Okay.
there are other aligners that are great too, but I've really kind of focused on the AirFlex because of all of its different treatment options.
So what stands out to you in terms of treatment outcomes?
Yeah, as a clinician, I think the main thing that stands out is, like I touched on before, the relapse is not really there. If a patient forgets their aligners when they're on a work trip, or, doesn't wear them as much as they're supposed to, it really stands out to me that they don't have to regress in their treatment so much. It might be a day or two of uncomfortable wear, but you won't get major shifting of the teeth. The teeth just don't have as much relapse with AirFlex. And then the other thing that stands out is when you're finishing a case, a lot of times with other aligner companies, you'll end up with these posterior open bites where just the thickness of the aligners themselves will push the teeth in, and you'll have to really account for this bite discrepancy and issue that you have to fix at the end. And I've noticed that maybe because of the thinness of the material of the aligners, or I'm no engineer, so I'm not exactly sure why this doesn't happen with AirFlex patients and OrthoFX patients, but I get a lot less posterior bite issues, open bites, and patients' bites are like where we want them to be, where it shows us that the occlusion was going to end up at. So it's really kind of amazing that we don't have to go through these refinements at the end,
Yeah.
lengthy refinements to get to this final result that we're looking for.
Yeah, because you add a refinement in it. That's 2 patient visits and then months more of treatment and a whole new set of aligners. It's a whole thing each time.
Exactly.
So if you can minimize those, it's huge for a practice.
Exactly. And the longer the patients are in treatment, the less compliant they'll get over time usually. So if you can, get them the result they need in a shorter amount of time, it's usually a win.
Yeah, I've actually been hearing that from a lot of doctors lately too, that the patients just get burnt out when you get past that first and second refinement. They just,
Yeah.
and compliance can actually go down. This isn't like a study, it's just anecdotal, but
Yeah,
I've heard it a lot from people. So
for
I like
sure.
hearing the alternative of that, where if we can't solve the patient compliance issue, let's just work with the limitations that humans do have and do a 12-hour wear that's more comfortable, less painful, and fits in better with their lifestyle.
Exactly. Yes, exactly. I still stress the patients to wear it as much as they can, just because you want them to wear it as much as they can. But, it's nice knowing that they're not going to have retracted results if they're not as compliant.
Yeah. And is there anything else you would add to why you exclusively use AirFlex now?
I just feel like it's become such a superior option that I don't really know why would a patient want to wear the aligners more.
Yeah.
It's nice to have the option, I think, and I'm sure there's a use for it. But, in my practice, when I mention, oh, we can go with this material and aligner that you can wear for 12 to 15 hours as opposed to 20, and it'll get you the results in the same amount of time, they don't normally say, oh no, I want to wear it longer. You know what I mean?
You
So
haven't heard that yet?
yeah.
Actually, could I get the 22? I like wearing it
Yeah.
longer. Okay, but with AirFlex,
So
the lab fee is a bit more to use AirFlex than the others. Maybe that's
yeah.
a question to ask here is, first of all, do you absorb that as a practice or do you pass that on to the patients and just have them pay extra to do an AirFlex case? Is the first question.
Yeah. That's a good question. No, I pass it on to the patient, and I think that they understand it, and it's the only aligner on the market that
Yeah.
is like that. So they kind of understand that, they are a little pricier, and most patients will go for it.
Yeah.
They're not people will spend money when they see value in something. We're all like that. It's human nature. And I think
Yep.
there is value in this. And so we don't get a lot of pushback from it. And I don't steer people in any direction. I will always give them all the options. It's
Yeah.
up to them to decide.
Yeah.
But most people will definitely do that, you know.
Yeah. So without even steering them, you see them going for it, even if they're absorbing some of that extra cost, and it's not really
Yeah,
an issue.
yeah. Yeah, most
Cool.
people
Thanks
will.
for
I mean,
sharing.
you'll get people who won't, but that's up to them. It's whatever works best for their lifestyle. For me, I think the most important thing is getting to know your patient and getting to know what motivates them, what are they valuing, and then we have all the options to provide them with what fits best in their lives.
Yep. Yeah, and I see doctors do this a couple different ways on this one. Some they just absorb the cost as a practice, but they see that as worthwhile just because of all the benefits on the back end and how the treatment goes and how it can be less refinements and all the other value you've talked about.
100%.
Like they're
Yes,
willing to pay for
100%.
that. But then some practices like you, which I think is really smart, is to pass that on to the patient and explain to them the value, show them the value, and then, like you said, it's not as big a hang up as a lot of people think it might be when you have that discussion.
Yeah, definitely. I think like any other product out on the market, there are tiers to pricing, and
Yeah.
we'll pay for what is important to us.
Awesome example. Okay, so what was the impact on your office of adopting the OrthoFX system?
I think at first we needed some help. So it was really nice to have the reps come in and teach us about like workflow, and getting a good scanner is important, something that's easy to use and fast. And so it wasn't that hard, I don't think, to implement the systems and the workflow. I think consistency is probably the hardest thing for an office and a staff and a team, is just to make sure that you do the same thing over and over and over again. But that once you do it, the first week might be rough. And then after that, it pretty much becomes second nature. And I think everybody has to believe in what they're doing. So if you can get the team on board with like, this is really better for us and for them, for the patients and for the staff and for everybody involved, I think the team implements it pretty easily. My staff does everything. I barely do anything. They enter all the cases, they take the scans. I'm just designing the plan.
Yeah.
But they've been taught to do everything.
Love that. Okay, and yeah, just so people know, we have an account executive and an implementation specialist that will support you through this whole process. So you can get your own team jazzed up about it and informed about it. Also, they'll come in and do a lunch and learn with you and get the team
Exactly.
informed, educated, so that they see the value. Then that comes through in the conversations that they have with the patients more readily. Also, you get that buy-in to
Exactly.
actually adopt the new system.
Right. Yeah. I think the staff, once they buy into it, they do it. And then the support that you get from OrthoFX is a lot. So I think,
Yeah,
whatever support an office needs, you guys, I think, are pretty good about giving it.
I agree. Yeah, and then if you can be uncomfortable for a week or two while you adopt a new system, just get through that week or two, and
Right.
then it can be smooth sailing, like you said. Okay, can you
Exactly.
share a case or patient story that helped solidify your confidence in this new system? Something that made you go from skeptic to believer, where you saw that and just thought, yes, I want to do more AirFlex cases.
Yes. There was a patient that traveled a lot. He was always kind of back and forth between continents. And so, making sure that he was on track, I was kind of like hesitant to put him in aligners, even because I wouldn't have as much control over seeing him and making sure he's on track. And kind of had a little bit of a heavier malocclusion, a lot of crowding, like things that I usually monitor pretty closely when the patients are in aligners. And I thought it was really amazing how the FX on track helped while he was away, really gave me a handle of like how he was doing. And he just kept so true to the progress that the initial treatment planning phase was showing us. So it was really amazing to see that even though I didn't see him as much, that he stayed on track, and I was able to kind of track it with this FX on track. And when he came in for his initial refinement scan, he was so close to being done. And he had like, a year and a half worth of aligners. Then we had maybe seen him once every like 2-3 months to kind of monitor him. And he was like so on track.
Yeah.
So yeah, I think after that, I really was like, oh, wow, this is like a really superior product.
That's a cool one. Yeah, and a lot of
Yeah.
doctors, they actually, if who do the doctors who do a lot of aligners, they'll overcorrect in their treatment planning. They'll kind of aim past the mark because they expect things not to track. So they aim a bit
Right.
further than where they want the teeth to go. And then
Yeah.
that's part of the strategy. But with AirFlex, we recommend people do not do that. And why? Because of what you just described, how it tracks. So, and it's
Yeah.
surprising because of what the experience with aligners has been for so many years. It's almost surprising at first. Like, wait, it's staying on track that well?
That's
Right.
right. Yeah, that's right. And actually, I think that another point that I didn't touch on is that the treatment plan is a lot more realistic than other aligner companies. Sometimes aligner companies will give you a treatment plan that you're like, I don't think it's going to do that. If you have enough experience with aligners, you're kind of skeptical that the teeth are going to jump like that, or that that kind of crowding is going to get corrected in a few aligners. But with OrthoFX, you could actually see that the process, that that aligner by aligner plan that they have actually makes sense. The teeth are flaring out and then they're coming in. They're not moving past each other in a way that's unrealistic. So I think the step-by-step plan is actually more realistic with the AirFlex plans that I've been given. Maybe that's why they're tracking better.
Well, it's got the material and the treatment plan software working together there. So,
Yeah.
is there anything else that you would like to share about your experience with OrthoFX that would help our listeners who are thinking of evaluating or changing to a new system or thinking of looking at AirFlex? Anything you would want to let them know or share that we didn't cover?
I would say, it never hurts to try anything. I think that OrthoFX makes it pretty easy to implement. It's not like it takes so much to try a new system. The support that you get from them is so massive that I don't think that there would be too many growing pains and doing a case or two and seeing how it goes. And just they've been around long enough where there's tons of testimonials out there as to how, OrthoFX does. So it's not like a brand new company that you have to kind of guess to see if it's going to go well or not. It's a reputable, aligner company that has shown results over time. So I think you just have to kind of have some faith and take a leap sometimes and try something, because most of the time, you're not going to have any change for the positive if you don't take that initial step.
All right. Thank you so much. Basically, what I want to follow up on there with what you just said is, as a company, we are very focused on making it easy for doctors to just try some cases and see what it's like for yourself. I
Right.
can't thank you enough for joining us today. We really appreciate your time and your willingness to share your experience and your stories. And I think a lot of people will benefit from this and will learn some great lessons from your successes you've had. So thank you.
Thank you so much. Thanks for
Yeah.
chatting with me.
And then thanks everyone else for your time today, for listening. If you'd like to learn more about OrthoFX or how to get started, then please visit orthofx.com and click Become a Provider.